Okay, so in this video, I'm going to be doing inspection, followed by palpation, followed by active, then passive, then resistive range of motion. I'm going to be doing end field assessment after passive range of motion. Okay, so here's my patient. First, I'm going to start with inspection. So inspecting his hip area. So, sir, are you okay if I lower your shorts? Alright, so inspecting his PSIS, looking for edema around his iliac, around his hip area. Also, are you okay if I raise this joint up? So I'm just looking at his greater trochanter area and around, and then I'm gonna do this bilaterally. So I'm gonna lower this up, okay? Checking that ASIS, where the psoas goes. I'm gonna check his greater trochanter, quads, and then I'm gonna also check his hamstrings. I'm just looking for redness, edema, some muscle atrophy, or some pathology of some kind. Then I'm gonna move on into palpation. Palpation would we'll start first with temperature check. All right, feels normal. Feels normal. I'm gonna check your opposite side. Okay. All right, normal. All right, so then I'm gonna move on to superficial palpation. Palpating his ASIS, his psoas muscle, his greater trochanter, his quads, his hamstrings, all his tendons. Any of that is tender at all? Now move on to depalpation. All right. Again, palpating his tendons, his muscles, his quads, his hamstrings, his TFL, his greater trochanter, his ASIS, his psoas muscle. Any of that tender? Okay. Now I would ask you to go ahead and face down for me. I'm going to palpate his hamstring muscles as well. I'm going to palpate his PSIS, his piriformis, his sacrum, and then all those muscles there, his glute max, glute med. Okay. Then I'm going to do that on the opposite side as well. Lift your leg up. Maybe. PSIS, sacrum, S1, S2, S3. Gonna palpate his greater trochanter again. Glute max, piriformis syndrome. His hamstrings, his pes serine as well. Gonna go ahead and palpate his TFL, greater trochanter again. Any of that tender?
No, sir.
All right. Now, while I have you down, I'm gonna go ahead and do active range of motion. Since it's prone already, let me flex this. For the sake of the video, I'm only going to be doing one side, and I'm going to be doing his left leg, although you're supposed to do it bilaterally, so always do both sides. Start in the non-involved side first, and then do the involved side. Since he doesn't have any pain or discomfort, I'm just going to start with his left leg, and then do it this way. So extension of his hip. Gonna place this in between pretty much at the center of the greater trochanter, and then stationary arm going down the leg, moving arm is gonna travel with his femur. Go ahead and try to extend the leg without moving your pelvis. Just try to raise your leg all the way up without moving that pelvis. Stop right there because you're moving that pelvis. All right, perfect. Go ahead and do it again. A little more. All right, that's fine. All right, you can go ahead and stop. So he has 15 degrees of extension. Remember, normal is between 10 and 15, so he's good. And then I'm gonna do lateral or external and internal rotation. So with your leg up like that. So first I'm gonna do external rotation. Zero that out. Keep it like that. All right, now what I want you to do is go ahead and move it to the side. Bring it to the side. All right, 10 degrees. And then what I want you to do is bring it back center. Go ahead and bring it to the inside. Inside like that. Without moving your pelvis. So I'm going to go ahead and stabilize that pelvis right there. Go ahead and push it inside. All right. 20 degrees of internal rotation, 10 degrees of external. Again, so did that cause you any pain or discomfort?
No.
So for external rotation, normal is between 40 to 60 degrees, and for internal rotation, normal is between 30 to 40 degrees. So he is a little limited in both of those. Now I'm gonna have him go ahead and face up. Lift that leg up. No, your right leg. Go ahead and bring it down. All right, I'm gonna go ahead and. All right. Again, I'm doing the left leg. Okay, finding the great center, putting it center there, and then try to flex your knee up. Bend that knee, and try to bring it to your chest. All right, good. So he has 90 degrees, and then what I want you to do is go ahead. Does that cause you any pain?
No.
Okay. So go ahead and finding that ASIS, putting that center there, and this leg, bring it with your toes up like that. Bring it out like this. All right. Go ahead and do it. All right. Stop because you're moving this pelvis. So there you have 35 degrees. Now, 35 degrees. Go ahead and come to the side more. Scoot a little more. Okay. Now what I want you to do is go ahead and bring it in. Okay. Go ahead and bring that leg in. All right. Is that it? All right. Good. So he had 35 degrees of adduction. Did that cause you any pain?
No.
So again, for flexion, he had 90 degrees. Normal is between 110 and 120 degrees. For abduction, he only had, I believe it was 30 degrees. The normal is between 30 to 50. And adduction, the normal is between 40 to 60 degrees. Did any of those movements cause you pain? No? Okay, so because there was no pain, now I can do passive range of motion. And I'm going to be doing end feel as well. Okay? So, go ahead and scoot to the right. Alright, pretty good. Alright, now I'm going to be moving the leg for you. Let me know if this causes you any pain or discomfort. Pain? Discomfort? Alright, soft tissue approximation for flexion. For abduction, pain or discomfort?
No.
Tissue stretch for pain or now for adduction, pain or discomfort?
No.
Alright, that feels like tissue stretch. Go ahead and face down for me, please, sir. Alright, pain or discomfort?
No.
Alright, pelvis extension, feels like tissue stretch. Internal and external rotation, pain or discomfort?
No.
What about there?
No.
Alright. Both felt like tissue stretch. Okay, so because he didn't have any pain or discomfort whatsoever, I'm going to go ahead and do resistive range of motion. Although if he did have pain or discomfort, I can still do these motions. It's fine. Resistive range of motion. Go ahead and try to kick your leg out. Pain or discomfort?
No.
Alright, good. I'll bring you back. Wait, actually, that was one. Okay, go ahead and raise your leg up. I'm going to try to push it down. Raise it up. Try to raise it. Pain or discomfort?
No.
Alright, good. Now, go ahead and try to bring it in. Right? Bring it in. No, so bring it in like that. Alright? Bring it in. Pain or discomfort?
No.
I'll try to bring it out like that. Bring it out. No, so not kick, but out. Bring it out. Pain or discomfort?
No.
1, 2, 3, 4, 5. Go ahead and turn the opposite way. Okay. Flexion. Go ahead and bring your knee to your chest. I'm going to try to prevent you. So try to bring your knee to your chest. Pain or discomfort? No. Keep doing it. Okay, good. Now try to bring your leg out. Do it. Pain or discomfort?
No.
Now go ahead and try to bring that leg in. Alright, go ahead and do it. Pain or discomfort?
No.
Okay, so that's inspection, palpation, active range of motion, passive, and feels, and resistive range of motion. Okay, so this next test, it's called the Patrick's test. It's also known as the Signal 4 test or Faber's test. So what I'm going to be doing is, sir, do you have any pain or discomfort in either side? No. So always remember to start in the non-involved side first. So what I'm going to be doing is flexing, abducting, and externally rotating that leg. I'm going to apply pressure at the opposite ASIS while slowly applying pressure down his knee. Do you have any pain? No. I'm going to do the same with the opposite side. Perfect. Pain? No. Alright, so pain either at his ASIS, gluteal fold, could be indicative for an SI joint problem, could also be arthritis or hip capsulitis, as well as fracture. Alright, so this next test is called the Peripheral Joint Clearance Test. I'm going to quickly stand up. So what I'm going to ask him to do is pretty much to stand up, squat, try to keep your face that way, try to keep your heels, go ahead and tuck in your gown in the front. Alright, so I'm going to ask him to squat down and see if his heels raise or if he has any pain in either his hips, knees, or ankles. Alright, sir, so what I'm going to ask you to do is pretty much just go ahead and squat down all the way. Alright, he's able to go all the way down with his heels on the floor. Did that cause you any pain? So if he had pain at either his hips, knees, or ankles, that would be a joint pathology in either one of those. Okay, so this next test, it's called the Anvil test. And what I'm going to do is go ahead and keep your legs straight. We want the knees extended as much as they can, so try to extend your knees. Do you have any pain in either hip, thigh, ankle? No? Okay, so what I'm going to be doing is I'm going to apply, I'm going to go ahead and tap. I'm going to be tapping your calcaneus, letting me know if that causes you any pain or discomfort, okay? Did you feel anything? No? Did you set the opposite leg? Did you feel anything? So, again, we're looking for some hip problem, groin pain, or and that would be indicative of arthritis, hip fracture, or capsulitis. Okay, so this is called the Trendelenburg sign. Trendelenburg sign. We're looking for glute medius. We're assessing the glute medius right there. So I'm stabilizing his hips. Go ahead and bring your right knee up. All right, hips are stable and level. Go ahead and lower it. On your left knee up. All right, same thing. If, however, when he's standing, that side drop, that would be a weak gluteus nerve. Weak gluteus medius, glute med muscle. It could also be a superior gluteal nerve neuropathy or a hip problem in that leg that's extended. Okay, so this next test, it's called the Thomas test. So, sir, what I want you to do is, do you have any pain in either thigh, hip? No? Okay. So go ahead and raise this knee up and hold it. Knee to your chest and hold it. Hold it and bring it up. So what I'm looking is if this leg raises a little bit, which it does. So that's a positive test for an iliopsoas, tight iliopsoas muscle. I'm going to go ahead and do it on this side now. Go ahead and raise that leg. Notice. Now bring it to your chest. It raised. So it's, again, positive bilateral iliopsoas muscles. Alright, so this next test is called the Aubert test. Sir, do you have any pain or discomfort in either thigh or hips? Alright. So I'm going to go ahead and start to go off facing that way. Go on your side. Good. What I'm going to do is I'm going to be raising your leg. Let me know if you feel any discomfort, okay? So I'm going to bring that leg back a little, extended up to 15 degrees, I'm sorry. And then I'm going to apply an I2S pressure on that iliac crest. And then I'm going to slowly lower it. Alright, so this is good for him. Normally, his knee should come and approximate that back knee, which he kind of does, so that's a positive test. Sorry, so that's a negative test. I'm going to do the same on the other side. Go ahead and face that wall. Okay, bringing leg up, applying slight pressure on the iliac crest, and slowly bringing it down. Again, they're almost together. So he doesn't have. So a positive test would be if when I lower that leg, it stays up. That would be positive, and that would be indicative of a TFL or IT band, a tight TFL or IT band. Okay, can you face that way? Thank you. So this next test is called the taking off the shoe test or toast test. Sir, so what I'm going to ask you to do, first of all, do you have any pain in the back of your thighs or anywhere? No? Okay, so what I'm going to ask you to do is first take your right heel, place it onto your left heel, and take off your shoe. There you go. Did that cause you any pain? All right, now do the same with your opposite foot. Any pain with that? Okay, so pain over his biceps femoris or anterior or posterior thigh would be a positive test, and it would be indicative of a biceps femoris strain.